May is Mental Health Awareness Month, and we're putting a spotlight on the issue this morning. Coming up in our 9 a.m. hour, we'll be talking a lot more about how to get help. But if you want to be the person someone turns to for professional help, there are several educational options if you want to get into the mental health care field. Joining me live to explain this morning is Mr. Kevin Rand, an associate professor of psychology at IUPUI. He's also a practicing therapist. Mr. Rand, thank you so much for your time this morning as we discuss this important topic. There are mental health counselors, social workers, psychologists, and psychiatrists. All of these careers require a few basic things. Tell us about that.
Well, what they all have in common is graduate education beyond the bachelor's degree, and then supervised clinical experience, and then there's the passing of a licensure exam. What varies is how much education, how much clinical experience.
You mentioned the license. Go ahead.
Go ahead.
You mentioned the license. What do licensed mental health counselors and clinical social workers actually do?
So they deliver clinical therapy, counseling therapy. They're often trained in specialized approaches to treating specific problems like phobias or anxiety or depression. And that's pretty much what they spend their time doing, is working either with individuals or couples or groups delivering therapy.
Psychologists must have a doctoral degree. That allows them to actually diagnose mental disorders. What else do they have to have?
So for a doctorate degree in psychology, you have to have 4 to 5 years of graduate education beyond the bachelor's, and then you do a 1-year-long clinical internship before graduating with the doctorate. And then you have to do, in Indiana, another year of supervised clinical training before you are licensed to practice independently.
And it varies from state to state. To be a psychiatrist, you have to have a medical degree. They're the only ones in Indiana who actually can prescribe medications for mental health issues.
The doctors and nurse practitioners, psychiatric nurse practitioners, can also prescribe medications. But yeah, they have to go to medical school just like any other physician, either get an MD or DO, do 4 years of that, then get their license to practice medicine, and then do at least 4 years of residency, often doing quite a bit more than that.
That's interesting. You, by the way, have a very unique role as a professor and a counselor. Tell us a little more about what you do.
So my main role is as a professor at IUPUI. I conduct research on stress and health and how people cope with stressors, especially health-related stressors like cancer and chronic pain. In that role, I teach undergraduate and graduate classes. I also train doctoral students who are going to go on to be clinical psychologists themselves. And I supervise practitioners who are kind of in that training phase of getting their clinical experience.
All right. Well, Mr. Kevin Rand, an associate professor of psychology at IUPUI, thank you for your time this morning, and we appreciate your work you're doing.
Thank you for having me.
No problem. If you'd like to learn more about the different educational requirements, just head over to our website, fox59.com/link.